crypts.
Yes, because when I look at this one, it's not arranged as nice as the other one I was looking at. The follicles are kind of on the outside, but they're kind of on the end. They're everywhere. It just doesn't have as much definition to it. And if I were going to ask this, I would probably focus it onto one of these two areas, like right here. You see that one spot? Looks like a river that is branched into a couple of tributaries, doesn't it? Okay, that's the crypt.
The what?
A crypt. A blind end cavity, basically. Here's another really long one right here. So if I were going to use, this is the adenoid slide. If I were going to do tonsils or adenoids, it's mainly to show the crypt. I'll stick with lymph nodes for our follicles and capsule and cortex and medulla because it's more organized.
What's the difference between the capsule and the crypt?
Capsule is a delicate outer covering around the entire organ, and a crypt is a infolding, a blind end infolding.
So on the lymph node, you're going to stick to the cortex, medulla, and
Cortex, medulla, follicle, capsule, trabeculae, all the ones we had just done.
Okay.
And the only thing I'll use adenoids or tonsils for is the crypt.
Okay.
That's good.
And I'll probably use it where you've got one where you can see kind of an end to the tubing, into that, and there's an end to it. It just doesn't. Good. Just making sure we've seen those twice. All right, so today we are going to continue a little further with our respiratory system. We're going to get down into the lungs, and so we're going to look at a couple of histology slides for the lungs here in just a second. But first we've got to just do the gross anatomy.